Okay, good night, everybody. It's 8 o'clock. Let's wait 5 minutes to your classmates, okay? And then at 8:05, we can start with the circle class. I think it might be enough time. Okay, can you watch my screen?
Yes. Yes.
Okay, perfect. So I think we can start because it's 8:05, as I said. And it's been enough time for your colleagues to get into patients. Okay, let's go ahead. Tonight we have some specific topics: the endocrine system, gynecology, pregnancy and birth, and a very, very, very vast view about childhood. Of course, all of them are general views, not getting into detail or checking the specific pathologies because of the time and the contents that are expected into this course. But if you want to talk about something extra, we can do it during the workshop tomorrow night, okay? So let's start. The endocrine system. Of course, you know, we have our anatomical review, as always. And well, we have this first chart and this list. Taking into account all the glands, I mean, okay, the important organs, as you know, just as an information for considering this and practicing our vocabulary, and adding the ways we can write them down. Check this. As you see, here's our red bag. Then we have the second chart. The pituitary gland secretes hormones that control activity of endocrine glands. We all know about it. The specific functions, how they work, which hormones they secrete. So consider this, study this for catching vocabulary. And we have the second chart talking about the same in the first part, taking into account the hypothalamus, pituitary gland, and pineal gland. And then in the thorax, we have the parathyroids, the thyroid, the thymus, and the relationship between the heart. Just general views, of course, okay? Okay, going on with the combining forms and the major structures, we have this. Adrenal glands, adrenal. Gonads, gonado. In male, testicles, testic or testicle. Female, ovaries, ovary or ovario. We all know about it. Pancreatic islets, pancreato, pancreato. Parathyroid glands, parathyros, parathyrodo. Pineal gland, pineal, pinelo. Pituitary gland, pituito, pituitaro. The thymus, thymo. The thyroid gland, thyroid, okay? As you know, the primary functions are for reading at home and checking specific vocabulary about them. Okay, so let's go ahead. The word parts again, we have the word root, the suffix, and some prefix, just for taking in account for catching the writing down way. Check all of this and the meanings. It's very important, okay? According to this, it's going to be easier to understand or to take in account this information and more that could be read on reviews or notes, I don't know. Talking in the endocrine system, we must consider this idea, the excess and deficiency. Of course, excess means too much. Too much according to hormone secretions, okay? Where there is an excess of hormone, one way of treatment consists on giving medication that inhibits the production of that hormone. For example, in hyperthyroidism, is treated with carbimazole. Carbimazole is the drug that is controlling the hormone levels. the excess, I mean. Talking about the deficiency, the meaning is too little, of course. And when a hormone is deficient, the treatment may be by replacement therapy. I mean, we introduce the hormone by different techniques, we can say. For example, type 1 diabetes is treated with injections of insulin, or another way with insulin shots. Okay, we all know about it. There's no other way. We must consider this. In my opinion, the negative feedback systems in this slide is for catching the vocabulary. That's the most important part in this. Why not checking the physiopathological processes or the processes of act? Because we are trying to get this specific vocabulary in order to express our ideas, just that. And as I was telling you at the beginning, we are not here for teaching specifically medicine. We are taking control under the specific vocabulary that is going to be useful in this way of speech between colleagues, or maybe for understanding our colleagues too, right? or Congress, I don't know. The negative feedback system is showing us how these hormones are secreted through the organism. So the TRH, the thyrotrophin releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone, in the pituitary or pituitary gland. The TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 thyroxine and T3 triiodothyronine, and also to release stored hormone, producing increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. You can see it's a circle they are making between one to the other. An infinite cycle, secreting the hormone and inhibiting the hormone. Okay, this feedback is very important to take in account. But in my opinion, just take the most important vocabulary, the blackened words. I have this one. This picture is very clear, I think. And not so common to check nowadays because of treatment we have the chance to receive in our diet. We have goiter or goitre. Both of them are the same. Goiter for American English, goitre for British English. You can see that's the only difference, the position of the R and E, E and R, and that's enough. Of course, we know this. This is the enlargement of the thyroid gland. Maybe diffuse, involving most of the gland, or localized, limited to a particular area, as a solitary or single nodule. The increased blood flow in diffuse enlargement may give rise to a palpable thrill, vibration felt when the hand and an audible bruit, noise heard through a stethoscope over the gland. If we receive the correct diet with salt with yodo, there is no chance to become in this way. Of course, it's an extreme situation, but it could happen. In Cuba, I had a patient with us, one that was being prepared to surgery for taking out the thyroid gland, because it was, of course, it was important to do it. And the thrill and bruit are, of course, easy to feel. I mean, the thrill, when you place your hand on the gland, in the middle of the gland, you feel how the blood is going away. On the road, according to the position, sometimes you don't even need the stethoscope for listening to that. That's a good opportunity. Maybe in town we have the chance to check a patient like this, but I was telling you, it's a very, very extreme situation. Well, yesterday we were talking in the workshop about a lady who went to the general practitioner because some symptoms that she was suffering from a period of time, 4 months with the last symptoms, and then a year with other situations that she was explaining during her speech. Actually, she is Mrs. Davis. And Mrs. Davis, according to the doctor's opinion, the general practitioner who checked this situation, decided to send her to an endocrinologist. So he prepared a letter of referral. This specific paper, this is a fragment, it's not complete. But again, here we have broken words and its meanings, right? That are signaled in the slide. So we have the chance to consider this information just for reading, for catching how to express these ideas, because we are going to practice and we are going to do our own letter of referral during the module 1, and we have to finish this on module 2. Okay, the general practitioner says, "Dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive, and at first she thought the weight loss was due to this. But more recently, she has developed palpitations, diarrhea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by my examination, which revealed an enlargement thyroid, red sweaty palms, and a fine tremor on the hands." Here we have some details to consider: the way to introduce the patient, the general data of her. The doctor is describing symptoms. He also is using some expressions of the patient, mixing with medical terms in order to make this paragraph interesting to the specialist in the first paragraph, as I said. In the second paragraph, he is supporting the diagnosis that is at the beginning of the information, talking about the physical exam and changing or exchanging the common expressions into medical vocabulary, medical terms. This exercise is very easy to make while doing this process, so take the vocabulary. Don't forget where the letter of referral example is, because we are going to work with this kind of paper, okay? Kind of form, I mean. About some pathologies of the endocrine system, we have to consider this list. As I was telling you, we are not going to take too much information about this topic because it's too many topics to take in count. But following the contents that the Institute is sending to me for preparing the material, until this point, this part is enough. About pathologies, we consider the pituitary gland with acromegaly, gigantism, hyperpituitarism, short stature, or pituitary adenoma, functioning, non-functioning, galactorrhea, prolactinoma. About the antidiuretic hormone conditions, diabetes insipidus, syndrome of inappropriate antidiuretic hormone, the SIAD. Then we have the pathology of the pineal gland, pinealoma, the thyroid gland, thyroid carcinoma, insufficient thyroid secretion, Hashimoto's disease, hypothyroidism, cretinism, myxedema. The parathyroid glands, hyperparathyroidism, hypercalcemia, hypoparathyroidism, hypocalcemia, excessive thyroid secretion, thyroid nodules, thyroid storm, hyperthyroidism, Graves' disease. About pancreas, insulinoma, pancreatitis, abnormal blood sugar levels, hyperglycemia, hyperinsulinism, hypoglycemia. Then we have about the thymus, thymitis, about the diabetes mellitus, metabolic syndrome, type 1 diabetes, type 2 diabetes. Then we have prediabetes, latent autoimmune diabetes in adults, LADA, gestational diabetes mellitus or pregnancy diabetes mellitus, diabetic emergencies, diabetic coma, insulin shock, non-diabetic complications, diabetic retinopathy, heart disease, kidney disease, peripheral neuropathy. About the adrenal glands, Addison's disease, adrenalitis, aldosteronism, Conn's syndrome, pheochromocytoma, Cushing's syndrome or hypercortisolism. About the gonads, hypergonadism, hypogonadism, gynecomastia. Okay, this is the common list. Then we have abbreviations again, the most common ones, maybe not the most important at this point, but just the most common in order to take them in count. Some colleagues were asking for if we should memorize all of the charts with abbreviations that I'm showing you, but actually it's not the way I work. I mean, I show you in the slides, the general and the common slides for taking an idea what is going on, right? But at this point, I'm not asking for memorizing all of this information because you don't need it. During homework from this week until the end, I'm going to send 1 or 2 lists into the file homeworks for filling blanks and completing meanings or matching columns with the meanings. And according to the ones I said, I'm going to take these abbreviations to the final test, not from the charts, because it's too much information that maybe we cannot use all of them. So take it in count, okay? Read them for catching the idea, but memorize, making a, I don't know, flashcards with this. My opinion at this point, it's not objective. There's too much vocabulary to do while doing this course. Let's go with gynecology. Again, a very, very general view, and fast. Again, our anatomical review, the external landmarks, anatomical details, of course. Take them in count just for practicing. Of course, homework is coming from these slides. Why? What happened? Our structures in the lateral cross-section. Check this, a very general view, of course, we're not making a mess with this. Everything in English. I made my best effort looking for them. So let's practice on this kind of a slide. Let's read all of them. Again, an anterior schematic view of female reproductive organs. We all know about it. Take it in count, consider this, read all of this. Everything is in English. Some words might look like Latin, but no, they are in English. Read them and memorize. And now I have this slide that is just for information, for catching vocabulary, but of course there's a question. Tomorrow we can solve the doubt. We have the breasts, how they are made up, all the structures that are involved in this body part, with the nipple, lobules, ducts, connective and fatty tissue, muscle, blood vessels, lymph nodes, sentinel lymph nodes. Check all of this, practice on this, read the specific vocabulary that it's indeed this slide, because it's nice to catch information like this. And we have our chart, the cross section and a frontal view of this, in order to take into account all the structures that are described in the previous slide, for taking into account. Okay. Okay. Again, the overview chart. As major structures, we must consider the reproductive systems. Just for information, the male organs in this chart, okay? In male, the penis, we use penny or fall, or phalli, or fallow. Testicles, orco, orchido, testi, or testo. For female, we have ovaries, and we said ophor, ophoro, ovari, ovario. The fallopian tubes, salping or salpingo. Uterus, hystero, metro, metrio, utero. Well, the vagina, vagin, vagino, colp, colpo. And the placenta, placent or placento. We all know about it. Okay, check the primary functions, please. I'm going to make questions from this exercise, these charts. These specific questions are useful. The word parts, again, we have the word root. We have the suffixes and the meanings for memorizing them. It's important to memorize these parts because it's a basis of our medical vocabulary. And now we have the first slide, the menstruation, the period. Of course, a normal condition in women, but not comfortable. A period is the common name of menstrual or monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes as LMP, last menstrual period, and with signal with this, 2 weeks ago. We know that 52 means weeks because the whole year has 52 weeks. I mean, it means that the last menstrual period was 2 weeks ago. Don't forget this detail, okay? The menstrual cycle, or length and frequency of periods, is usually written in the form 4 bar or /28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhagia, often with the passage of clots. of course, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. Okay. These formulas, 252, 428, or according to the patient situation, we can write down this specific one is the best and the most common way, similar to Spanish, I mean. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, is known as the change of life or simply the change. Symptoms of menopause include hot flushes, that sudden sensation of heat, and night sweats. The patients, when they describe these hot flashes and night sweats, describe them as a non-comfortable situation. So we must take it in account. Now we have to consider this for evaluating the situation, I mean. Check the vocabulary, practice on this, and tomorrow we can work on this information. This is just an information slide for showing you the menstrual cycle and the phases of this. For catching vocabulary, I'm not going to ask from this slide specifically, but for having the correct ways to express these ideas, I'm sending it to you. We talk about the menstrual phase, post-menstrual phase, ovulatory phase, and premenstrual phase. Take in count, as you could see we have the word root and how the change in prefixes are changing the meaning. And a review of this red guy is showing us these phases, but just for practicing and catching the vocabulary, okay? Catching the specific ways to give these expressions, to give these ideas about the menstrual cycle, the follicular phase and the luteal phase. The follicular development, pituitary and ovarian hormone levels, and endometrial cycle. We all know this chart. Just practice on this, and according to this information, we can talk about it tomorrow, okay? It's a lot of information to check. Symptoms. The menstrual pain, non-comfortable, of course. We have abdominal pain, increases the chest, the back pain, headache. Some suggestions, what can you do? Of course, the diet, some pills, painkillers, massage could help, warm, sleep, or some patients walk. So according to these ideas, we have a chance to recognize this menstrual pain. Of course, it's not the same. All women have different way to suffer this period, but well, we must take it in count. Okay, gynecological consultation. Sometimes, well, not sometimes, all women, we have to go at least once a year to gynecologist to take in control and to check how we are going on. And they are the most common questions that a gynecologist make. So I'd like to work with you volunteers. I need one gynecologist and one patient. Who would like to read it?
I'm here, Iris.
Perfect. One is Neil, another one voluntary.
Me, teacher.
Perfect, Vivian. Okay, Neil, you are the gynecologist, and Vivian, you are the patient. Go ahead, please. I'm listening.
Okay. Are your periods regular?
Yes,
How often do you get them?
every 4 weeks.
How old are you then you started to get them?
About 12.
When was your last period?
A week ago.
How long do the periods last usually?
4 or 5 days.
Could you say they are light or heavy?
Light.
Do you get the clothes?
No.
Okay. Do you get period pains?
Not really.
Is there any discharge between the periods?
A little.
What color is it?
White.
Thank you so much, both. As you can see, gynecologist has a very difficult situation, I mean, because asking this kind of question sometimes is not easy. And patients, well, we have to answer. We don't have any other choice. We only have to say the truth. We have to be honest and give the information the doctor is asking for. We all know about it. If we translate all of these answers into the formulas in the case report, you might see that it's a very short paragraph to show. And then if we are not sure about these meanings, it could be confusing. Just as an example, right? The common questions, of course, are all of them. Let's take them in count. And if you have a suggestion about something different, a different way to ask for, I mean, it's possible to make it. It's possible to do it. Don't worry about it. Just we only need to be creative while doing a correct question, maybe another way. The objective is to get in contact, right? About contraception, we have all of these methods. The condom, the female condom, the diaphragm, hormonal ring, UID, contraceptive injection, implant, contraceptive patch, oral contraception, and surgical sterilization. This specific vocabulary, well, we have to memorize it. Moreover, we have this chart that is showing us how well does birth control work. Taking the percentage, we have the chance to read, to memorize, and consider this information. For example, 99% effective IUD, intrauterine device, the implant, and sterilization, of course. 92 to 97% effective, depending on the method, the shot, hormone shot, the pill, the ring, and the patch, hormonal medication, right? 78 to 85 effective percent, depending on the method, diaphragm, condoms, internal and external, spongy, and cervical cap. 71 to 76 effective, depending on the method, spermicide, fertility awareness, and withdrawal, right? Take into account, memorize this. Well, if we make a contrast between this slide and the previous one, you would see that there are some differences showing you the different methods. Combine them, check the information, okay? And now pathologies. The interesting part, I think, the common part while talking about it. We have about ovaries, fallopian tubes, and ovulation, oophoreitis, ovarian cancer, ovaryorexis, pelvic inflammatory disease, polycystic ovarian syndrome, salpingitis, the uterus, endometriosis, metrorrhea, endometrial cancer, uterine fibroid, myoma, uterine prolapse. About the cervix, cervical cancer, cervical dysplasia, cervicitis, endocervicitis. The vagina, colporexis, dyspareunia, leukorrhea, vaginal candidiasis, vaginitis. Okay, and now more of them. External genitalia, the pruritus vulva, vulvodynia, vulvitis. Breast diseases, breast cancer, fibroadenoma, fibrocystic breast disease, galactorrhea, mastalgia, mastitis. About menstrual disorders. Amenorrhea, dysmenorrhea, dysfunctional uterine bleeding, the DOB, hypermenorrhea, hypomenorrhea, menometrorrhagia, oligomenorrhea, polymenorrhea, premature menopause, premenstrual syndrome, and premenstrual dysphoric disease, PMDD. Then abbreviations, the common ones, just check them. I think they are so short. We of course have too much, but consider them as general information. Here we have some abbreviations that are including the pregnancy period and the delivery period. So we have the amniocentesis, for example, the cesarean section. We have also the labor and delivery, take it in count. The neonatal intensive care unit, very common. Take it in count, read this. Let's practice on this, okay? And now we got this picture. Does anybody in this class know who's this lady? Maybe got an idea about this body? Well, actually, there is an anatomical exposition and an anatomical museum that is going, well, that was going around the world, showing models like here, showing bodies, real people that their corpse was donated to the museum in order to prepare anatomical structures into a museum to show to the Legos, to the common people. In order to make it interesting, they decided not to stay in the country. And they were used to travel around the world, showing this exposition and showing how marvelous is our body inside. They were supposed to come to Bolivia, I think 4 or 5 years ago. I'm not sure at this point. But they didn't. Why not? Well, this specific lady is considered a murderer. Why a murderer? Because in South Korea, there was a lady who was falling in love with a man, a non-correct man. I mean, he has his factory. He was in a very good economical position, but he was married. And well, they were cheating the spouse of that man. This lady got pregnant, and when she was 8 months around, she disappeared from home. When she was younger, she had a family, she was divorced. She had 2 teenagers, but suddenly she disappeared because nobody could find her during her pregnancy. The family at the beginning thought that she was lost. She ran away with his lover. But the truth was not, because the man was still in South Korea. The family get worried because she was pregnant, the baby, it's not easy to get away. They were looking for her with the police. She was considered a missing person, maybe kidnapping, who knows. The fact is that once in this museum about bodies, they found this lady, this model, and checking the face anatomy, the body structure, and the period of pregnancy, they got on demand on a loyal situation against to the museum because this is the lady that was disappeared. Nobody knows how she arrived into this collection, but the museum has a confidential contract when they are showing that they received the corpse of this pregnant woman as a donation. So according to South Korea laws, well, they are catching all the museum for making investigation, and this process is not going ahead. It's so sad because, well, she wanted to be a mother again. And you can see in this structure, this body, the baby is ready for getting born. So just as an extra information, an interesting detail maybe. On the internet, you could find lots of pictures about bodies, lots of cuts, anatomical cuts for checking inside all the anatomical structures in different positions, different actions. It's nice. I really recommend you to check this. Let's talk about pregnancy and birth. We have, of course, these charts showing a normal pregnant with just one baby and showing twins, fraternal twins in uterus. They are nice, I think. We have the changes in our organs positions during pregnancy. That's why we suffer all of these periods. Suffering in landmarks, because it's amazing. Well, we have the opportunity to live it not too many times in life, so let's take it in count. And you can see how every organ is getting out of place, getting smashed, getting bigger, changing position, and of course, changing functions in order to let the fetus develop, grow up. We have the chance to create a full organ, the placenta, to feed the baby and take care. Talking about the childbirth, very important information and lots of vocabulary here. The childbirth is the expected date of delivery, abbreviation EDD, is the date on which a woman is expected to birth to the child she's carrying or she's pregnant with. It is calculated by adding 280 days or 40 weeks to the first day of the last menstrual period, LMP. Childbirth is also referred by doctors as parturition. So if you read parturition of childbirth, they are synonyms. Delivery is the process of helping the child to be born. This is the delivery, to pick the baby up and give him or her to the mother. A spontaneous vaginal delivery, SVD, is a normal delivery. If there are complications, the baby may be delivered by a cesarean section, the surgical removed. In order we check the last abbreviations. The abbreviation, of course, is C-section, right? Cesarean section. Check this. A full-term pregnancy is 40 weeks divided into 3 trimesters. A baby who was born before this is premature, and one who's born after 40 weeks is post-mature. A baby who's born dead, for example, because of umbilical cord is around the neck, is stillborn. Okay, a newborn dead and stillborn. Don't forget about it. A pregnancy may end before term spontaneously with a miscarriage, spontaneous abortion, or maybe be deliberately terminated with an induced abortion, the termination of pregnancy because it was desired. Note, the verb induce means to cause something to happen. That's why induced abortion, we make it happen. It was not natural. For example, we have the threatened miscarriage, the risk, inevitable miscarriage, the incomplete miscarriage, and the missed miscarriage, right? Take this slide in count. About the labor is the process by which the fetus and the placenta are pushed out of the uterus. This process, as I was telling you, is labor, don't forget it. The cervical effacement is how it changes in size for letting the baby to pass through this channel, this space, okay? Not affected, cervix is fully effaced and dilated to 1 centimeter. Cervix is dilated to 5 and fully dilated at 10. So cervical effacement, right? Then we have the childbirth, consists of 3 stages. The stage 1, the dilation. There are 3 phases. The stage 2, the birthing stage, during which the baby is born, right? And the stage 3, the placental stage, during which the placenta is delivered or is expelled. We all know about it. Check this information, read the chart. The cervix relaxes in the stage 1, causing to dilate and thin out to get bigger, to get open. In stage 2, the uterine contractions increase in strength and the infant is delivered, is pulled out. And the placenta is expelled in the stage 3. The ones who had a natural delivery, we all know how it hurts. So take it in count. Again, the stages labor, just for taking again the vocabulary, and during the description of the chart, you have ways of describe this without any trouble. Talking about presentation and lie, well, we must consider this. The fetal lie is the position of the fetus in the uterus, inside the uterus. The normal lie is longitudinal, like this. And the abnormal lie is transverse. Could be in vertex presentation, bridge presentation, and in transverse lie, the shoulder presentation. The fetal presentation refers to the part of the fetus which occupies the center of the pelvic canal and which the examining fingers feel on the vaginal examination. The bad word. The normal presentation is with the head. As we said, the vertex presentation. This chart to check. About bridge presentations, it means that buttocks are presenting. Bridge is an old word of buttocks, but following the medical vocabulary, the old one, we still use bridge to show it. Maybe some doctors could say buttock presentation or gluteal presentation, but not. The correct term is bridge presentation. Okay. And this is an extra data. Normal presentations may require delivery with forceps, but now actually we don't use this. We prefer not to cause more harm with this device. According to the bridge presentations, we have the frank, the complete, and the incomplete. No matter which one you find, well, this is the most common for helping or for supporting a delivery in bridge presentations, of course, needs experience to be developed. Not every doctor knows how to do it. And by personal opinion, I had two opportunities to check deliveries like this, but they were developed by an obstetrician, because it's not easy. Not easy. You have to know how to move it, how to free the shoulders, and how to move the head for not harming the baby. I have to be honest, I cannot do this. It's not for me. If I find a bridge presentation, C-section to the specialist, not for me. Well, we have this chart showing you more presentations. Again, the vertex, the face or brow, shoulder or transverse, frank bridge, complete bridge, incomplete bridge with foot-link bridge. Just one foot is going out. Let's talk about childhood. Our kids, the most amazing people in the world. As a general view, of course, childhood is the period which a person is a child, from birth until puberty, a very short period of time, in my opinion. We have to consider the milestones. Milestones is the most important part of this presentation, because we have lots of vocabulary here. Of course, milestones is a child's development by age, from newborn until catching all the experiences. It never ends. Yeah, no, I'm sorry. We have this chart where we are showing month by month the development of the baby, how they are gaining capabilities, how many words, well, examples. We all know about it. We have the chance to check it with our kids and consider this information. Read this, and according to the vocabulary here, we are going to work tomorrow and during the next workshop, I think. We have a second chart here that is giving more information than this. I mean, both of them making a contrast, complete each other, and it's easier to catch more vocabulary and ways to express this. For example, the 3 C's, crib, crawl, and cruise, to take in count, okay? So read this and practice on this. There are some abbreviations, and we can solve them tomorrow, because it's important to talk about it if it's necessary. But as general practitioners, we must consider this. There are 5 key areas of development. We have the gross motor skills, for example, crawling, jumping, or running. Fine motor skills, such as writing or drawing. Speech and language. Cognitive and intellectual, such as counting or identifying shapes. Social and emotional skills, such as playing with other children. We all have the chance to practice or to evaluate kids during the career, I mean. And in that way, we have the chance to recognize these areas, these development areas. In that way, we have the chance to recognize some diseases, some situations maybe, and then start the correct treatment, always following advices. Common infectious diseases in other countries are, for example, this column is for medical terms. I'm sorry. And this one is the common name. The common name when parents come to us and tell us and try to explain us the situation. They come with an idea with sometimes a good diagnosis, but that's the way they call the situation, and that's the way we as medical health providers should call this. Morbilli or rubella, the common name is measles. Rubella, the German measles. Varicella, chickenpox. Infectious parotiditis, the mumps. I'm sorry for my typewriting. I'm going to correct it previous sending to you. The pertussis, the whooping cough. Acute laryngotracheitis, the croup. scarlet fever. Rheumatic fever is the same, rheumatic fever. Tetanus, lockjaw, poliomyelitis, the polio. Check this. That's a good way to start talking about it. And now we have this chart showing us in a specific situation, the celiac disease or the celiac disease. I mean, in UK, you have this way of writing down, and in USA, you have this way of writing down. In black and words, you have the specific vocabulary to practice, and then you have the meanings in the second chart. So let's read. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy and childhood, it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood. Check the meanings, check the vocabulary, practice on this. The black and words are showing us, right? And please just keep working, keep on practicing, okay? That's all for tonight. So let me send you the poll to take attendance. We're almost on time. Fill the poll and give me a second to upload the presentation, the slides to the Zoom chat. Okay, it's done. Okay, as always, please let me know as soon as you get the file, as soon as you can download it. And I'm sending this now. Okay. Please let me know via message. We don't, well, you know how to do it. Thank you, Andrea. I need one. All of you can watch the pool. There is one classmate that is not filling the pool. I'm sorry, I need it to send attendance to the academical supervisor. Can you all of you watch this? Hello. Okay, in order you fill the pool and download the slides, well, you can leave the Zoom session. That's okay. Okay.
Bye, teacher.
Bye. Bye-bye. Don't worry about it. Bye.
Bye-bye.
Bye-bye. Have a good night.
Thank you.
Okay, you're welcome. Don't forget, if you don't fill the pool, there's no attendance. What classes you might fill the pool? If you don't fill this, there is no attendance. I cannot support you. We're here.
Doctor, I did fill the pool, but I don't know if you get mine. Oh, or did you send it again?
No. I didn't relaunch it. Don't worry about it. If you feel it, Dalila, it's
Okay.
okay. Don't worry about it.
Okay. Thank you. Bye.
Bye, Dalila. See you tomorrow.
See you tomorrow.
Bye. Diego, are you there? Diego? Well, I'm closing this pool. Well, I'm closing the Zoom session. Goodbye, Diego. Well, patience. Bye, Diego. See you tomorrow. Have a good night. I cannot stand for more.